I am Dr. Thina Peter. Today, I'll be talking about male pattern baldness, also known as androgenic alopecia. Androgenic alopecia is a common form of hair loss in both men and women. In men, usually hair is lost in a well-defined pattern beginning above both temples. Over the time, the hairline resides to form a characteristic M pattern. Hair also thins at the crown near the top of the head, often progressing to partial or complete baldness.
24 Local.
One cause of male pattern baldness is genetic or having a family history of baldness. Male pattern baldness is associated with male sex hormones called androgens. The androgens have many functions, including regulating hair growth. Each hair on your head has a growth cycle. With male pattern baldness, this growth cycle begins to weaken and the hair follicle shrinks, producing a shorter and finer strands of hair. Eventually, the growth cycles for each hair ends and no new hair growth is in its place. Inherited male pattern baldness usually has no side effects. However, sometimes baldness has more serious causes such as certain cancers, medication, thyroid conditions, and anabolic steroids. Caring for your hair each day is essential to reduce the risk of alopecia and keep your hair in a great health. Be especially vigilant if your alopecia or baldness runs in the family. Eat a balanced diet, especially ensuring that you are getting enough protein, iron, zinc, magnesium, vitamins, as these nutrients are essential for healthy hair. Avoid smoking, as tobacco significantly increases the risk of aggravating existing androgenic alopecia. Limit harsh hair styling practices, tight hairdos like plaids, buns, chemical dyes, hair straighteners, overly hot hair dryers. Protect your hair from the sun, as UV rays can damage your hair and contribute to hair loss. Wherever possible, avoid sources of stress which can markedly exacerbate the hair loss. Massage your scalp regularly to stimulate the blood circulation. Don't wait until your hair has thinned considerably to react. Treatments are much more effective and started as early as possible. See your doctor as soon as you notice the first sign. We will help you to determine the cause of your hair loss through a clinical examination, such as blood tests and also a detailed analysis. We will then decide on a suitable treatment, such as topical treatments, oral medication, or even hair implants in the more severe cases. Thank you. Today, I'll be discussing about PRP hair treatment. Okay, PRP hair stands for platelet-rich plasma, where I'll be using your own growth factor by withdrawing the blood from yourself, separating with the centrifuge machine, and then I'll get the plasma and inject back directly on your scalp. It is a safe method because I'll be using your own blood growth factors and it's proven to give you results. PRP hair treatment is suitable for clients who are experiencing excessive hair loss. So when you're combing your hair and you're noticing a lot of hair loss or it's visible on your bedsheet, you are the best suitable candidate for this treatment. This procedure is called as lunch hour procedure. It only takes about 45 minutes and it's pain-free. Every client is important and unique. We do care for you and make sure you see the result in our clinic. So get your PRP done today at Peter's Radiant Clinic.